Are you curious about the uses of acetaminophen and how it can benefit you? In this informative video, we will explore the common purposes, potential benefits, side effects, dosage guidelines, and potential dangers associated with acetaminophen. Acetaminophen, also known as paracetamol, is a widely used medication known for its pain-relieving and fever-reducing properties. It is commonly used to alleviate headaches, muscle aches, and toothaches, as well as to reduce fever caused by various conditions. But what are the potential benefits of acetaminophen? How can it help you manage pain and fever effectively? And what potential side effects and dangers should you be aware of when using acetaminophen? In this video, we will dive deep into these questions and provide you with essential information to make informed decisions about using acetaminophen. Whether you're a healthcare professional or simply seeking reliable information, this video will equip you with the knowledge you need. So, let's get started and unravel the facts about acetaminophen. Common uses of acetaminophen. Acetaminophen is commonly used for various purposes due to its pain-relieving and fever-reducing properties. One of the most common uses of acetaminophen is for headache relief. Whether it's a tension headache or a migraine, acetaminophen can provide effective relief by reducing the pain signals in the brain. Additionally, it is often used to alleviate muscle aches and toothaches, making it a popular choice for individuals experiencing these types of discomfort. Another common use of acetaminophen is to reduce fever. It is often used to manage fever caused by infections such as the common cold or flu. By lowering body temperature, acetaminophen can help individuals feel more comfortable during periods of fever. It is important to note that while acetaminophen can reduce fever, it does not treat the underlying cause of the fever, so appropriate medical attention should be sought if symptoms persist or worsen. In addition to these common uses, acetaminophen can also be used to relieve minor pain associated with conditions such as arthritis, menstrual cramps, and backaches. It is widely available over the counter and can be easily accessed for self-care purposes. However, it is crucial to understand the appropriate dosage guidelines and potential side effects to ensure safe and effective use. Benefits of using acetaminophen. Acetaminophen offers several benefits when used as directed. One of the key advantages of acetaminophen is its pain-relieving efficacy. It works by inhibiting the production of certain chemicals in the body that are responsible for transmitting pain signals. This mechanism of action allows acetaminophen to provide effective relief for various types of pain, including headaches, muscle aches, and toothaches. Another significant benefit of acetaminophen is its fever-reducing properties. By lowering body temperature, acetaminophen can help individuals feel more comfortable during periods of fever. When used appropriately, it can aid in managing fever caused by common infections such as the flu or cold, allowing individuals to rest and recover more easily. Furthermore, acetaminophen is generally well tolerated and has a low risk of causing stomach irritation, unlike some other pain relievers. This makes it a suitable option for individuals who may have sensitive stomachs or are unable to take non-steroidal anti-inflammatory drugs, NSAIDs, due to certain medical conditions or medication interactions. Additionally, acetaminophen is available in various formulations, including tablets, capsules, and liquid forms, making it convenient for individuals of different ages and preferences. Potential side effects of acetaminophen. While acetaminophen is generally safe when used as directed, it is important to be aware of potential side effects. One of the most significant risks associated with acetaminophen is liver damage. Consuming excessive amounts of acetaminophen can overwhelm the liver's ability to process the drug, leading to liver toxicity. This risk is especially heightened when alcohol is consumed concurrently, as both alcohol and acetaminophen can strain the liver. In addition to liver damage, acetaminophen can also cause allergic reactions in some individuals. Symptoms of an allergic reaction may include rash, itching, swelling, dizziness, or difficulty breathing. If any of these symptoms occur after taking acetaminophen, medical attention should be sought immediately. It is also important to note that acetaminophen may interact with certain medications, so it is essential to consult a healthcare professional or read the package insert for any potential drug interactions before using acetaminophen. Furthermore, long-term and high-dose use of acetaminophen has been associated with an increased risk of kidney damage. Individuals with pre-existing kidney conditions or those taking medications that can affect kidney function should exercise caution when using acetaminophen and consult a healthcare professional for appropriate dosing guidelines. To minimize the risk of side effects, it is crucial to follow the recommended dosage guidelines and avoid exceeding the maximum daily dose of acetaminophen. If pain or fever persists despite the recommended dosage, medical advice should be sought to determine the underlying cause and explore alternative treatment options. Dosage guidelines for acetaminophen. To ensure safe and effective use, it is important to follow the appropriate dosage guidelines when using acetaminophen. The recommended dosage for adults is generally 325 to 650 mg every 4 to 6 hours, not exceeding a maximum of 3,000 to 4,000 mg per day. However, it is essential to read the specific instructions and labeling on the packaging, as dosing recommendations may vary depending on the formulation and strength of the acetaminophen product. For children, dosing guidelines are based on weight and age. It is crucial to use the appropriate measuring device, such as a calibrated oral syringe or a dosing cup, to ensure accurate dosing for children. It is also important to consult a healthcare professional or refer to pediatric-specific dosing charts for the correct dosage based on the child's age and weight. When using combination products that contain acetaminophen, such as cold and flu medications, it is essential to check the ingredient list to avoid unintentional overdosing. Acetaminophen can be found in many over-the-counter medications, so it is important to be mindful of the total amount of acetaminophen consumed from all sources to avoid exceeding the recommended daily dose. If you are unsure about the appropriate dosage or have any concerns, it is always best to consult a healthcare professional for personalized advice. Dangers and precautions when using acetaminophen. While acetaminophen can provide effective pain relief and fever reduction when used as directed, there are potential dangers and precautions to be aware of. One of the most significant risks is the potential for accidental overdose. Exceeding the recommended dosage or combining multiple acetaminophen-containing products can lead to liver damage and other serious health complications. To minimize the risk of accidental overdose, it is crucial to read and follow the dosing instructions on the product packaging carefully. Avoid taking more than the recommended amount or using acetaminophen for longer than directed without medical supervision. If you accidentally take more than the recommended dose, seek immediate medical attention, even if you do not experience any immediate symptoms. It is also important to be aware of potential drug interactions. Certain medications, such as blood thinners, anticonvulsants, and certain antidepressants, can interact with acetaminophen and increase the risk of side effects. It is essential to consult a healthcare professional or pharmacist before using acetaminophen if you are taking any other medications or have any underlying health conditions. Additionally, individuals with liver disease or a history of alcohol abuse should use acetaminophen with caution, as they may be at an increased risk of liver damage. It is advisable to consult a healthcare professional before using acetaminophen in these situations. Lastly, it is important to store acetaminophen safely, out of reach of children and pets, to prevent accidental ingestion. If accidental ingestion occurs, seek immediate medical attention. Alternatives to acetaminophen. While acetaminophen is a widely used and effective medication, there are alternative options available for pain relief and fever reduction. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, are commonly used alternatives to acetaminophen. NSAIDs work by reducing inflammation and relieving pain, making them suitable for conditions such as arthritis and menstrual cramps. However, it is important to note that NSAIDs may carry their own set of risks and potential side effects, including stomach irritation, increased risk of bleeding, and kidney damage. It is advisable to consult a healthcare professional or pharmacist to determine the most appropriate medication for your specific needs, taking into account any underlying health conditions or medication interactions. Non-pharmacological approaches can also be considered as alternatives or complementary strategies for pain relief and fever reduction. These may include rest, applying cold or heat packs, practicing relaxation techniques, or seeking physical therapy or other forms of therapy depending on the nature and severity of the pain. It is important to remember that every individual is unique, and what works for one person may not work for another. It is always best to consult a healthcare professional for personalized advice and to discuss the most suitable options based on your specific circumstances. Frequently asked questions about acetaminophen. Is acetaminophen safe for children? Acetaminophen can be used in children, but it is important to follow the appropriate dosing guidelines based on the child's age and weight. Consult a healthcare professional or refer to pediatric-specific dosing charts for accurate dosing information. Can I take acetaminophen if I have liver disease? Individuals with liver disease should use acetaminophen with caution and under the guidance of a healthcare professional. Liver function tests may be necessary to monitor liver health while using acetaminophen. Can I drink alcohol while taking acetaminophen? It is generally advisable to avoid consuming alcohol while taking acetaminophen, as both alcohol and acetaminophen can strain the liver. Combining the two can increase the risk of liver damage. Can acetaminophen be taken during pregnancy or while breastfeeding? Acetaminophen is generally considered safe for use during pregnancy and while breastfeeding. However, it is always best to consult a healthcare professional before using any medication during pregnancy or while breastfeeding to ensure safety. Can I take acetaminophen with other medications? Acetaminophen may interact with certain medications, so it is important to consult a healthcare professional or pharmacist before using acetaminophen if you are taking any other medications or have any underlying health conditions. Tips for safe and effective use of acetaminophen. To ensure safe and effective use of acetaminophen, consider the following tips. Read and follow the dosing instructions on the product packaging carefully. Use the appropriate measuring device, such as a calibrated oral syringe or dosing cup, for accurate dosing. Be mindful of the total amount of acetaminophen consumed from all sources to avoid exceeding the recommended daily dose. Avoid taking more than the recommended amount or using acetaminophen for longer than directed without medical supervision. Store acetaminophen safely, out of reach of children and pets, to prevent accidental ingestion. If accidental ingestion or overdose occurs, seek immediate medical attention. Consult a healthcare professional or pharmacist before using acetaminophen if you are taking any other medications or have any underlying health conditions. If symptoms persist or worsen despite the recommended dosage, seek medical advice to determine the underlying cause and explore alternative treatment options. Conclusion. Acetaminophen, with its pain-relieving and fever-reducing properties, is a commonly used medication for various purposes. It can provide effective relief for headaches, muscle aches, toothaches, and fever caused by infections. However, it is essential to be aware of potential side effects, dosage guidelines, and precautions associated with acetaminophen to ensure safe and effective use. If you have any concerns or questions, it is always best to consult a healthcare professional for personalized advice. By understanding the uses, benefits, potential side effects, and safe use of acetaminophen, you can make informed decisions about its appropriate use for your specific needs.